So next I am doing the client and infant safety. So here is my room. There's the baby and Mrs. Stark. All right. Should be good. And I'm knocking, and we're acclimated with each other, so I don't need to reintroduce myself per se. So hi, Mrs. Stark. Looks like the physician's going to be sending you guys home today. How do you feel about that? Yeah, I know I was really nervous too, but also really excited to get home. And so I was wondering if you had any specific questions, anything you're worried about, or anything we haven't covered or that's come to mind so far. We'll send you home with plenty of material, but now's a great time to ask any questions that you have. So she doesn't have any questions that come to mind right now. I wanted to review a couple things just to make sure. I know you've had a lot going on. You are going to be breastfeeding Ava, and so do you know how often you should be feeding her? Yeah, every 2 to 3 hours. If you decide to supplement or do switch to formula, she will be able to go a little bit longer, so 3 to 4 hours. You know, every baby is different, and that might be more frequent sometimes. There are such thing as cluster feedings. So one thing to go over is babies do lose a ton of their heat through their heads, or most of their heat through their heads. So keeping a hat on is very, very wise to do, especially with it still not being so warm yet this year. And you're going to want to keep her cord nice and dry. No tub baths yet until it has fallen off. These diapers that the hospital provided, they do have a little divot that will not go up over the cord, but if you don't have those at home, that's fine. I would just recommend folding it down, and that way that cord still has room and doesn't get, if there is a big blowout nasty diaper, it's not caught up in that mess. What about, I know this is your first baby, what about car seats? Would you mind if I show you just how to strap her in and make sure it's nice and tight? So, first thing, with it still being kind of cool outside, I know you're going to want to keep her nice and warm. If you do have blankets, it's recommended that they go up and over the car seat and not underneath those braces. And so I will show you. Now we're pretending she's the car seat, so we're going to put her in. You're a car seat now, not the mom. And we'll get her arms situated and put these. You want to be able to put a finger. You don't want it to be too tight to where it's going to cut off any circulation or be digging into her, but you do want it nice and tight, and you'll strap it here. Again, if she has like a big coat or one of those big onesie bulky things, you'll want to take her out of that, because that's going to make those braces on the car seat not up against her skin and keeping her body nice and secure in that seat. Does that make sense? Now, is there anything that I can do for you? Anything else that you'd like to go over? When will you go to the doctor? So it is recommended that you see her pediatrician within 48 hours. They're going to want to check a weight and just see how she's doing overall. If she hasn't had that hepatitis B injection, they may want to do that at that pediatric visit just to get that protection going. And since she is so tiny and she has not been vaccinated for anything other than maybe that hepatitis B, we do recommend that she is not exposed to big groups. Just try your best to keep her away from big groups, to keep people from touching her face or kissing her on her lips. I know she's so cute and that's all you want to do, but it's just for her safety. All right, anything else? No? Okay, great. Let me know if I can help you before you guys go, or if you have any questions that come up, just hit your call light and I'll be right here. All right? Thank you.